we will talk about leg swelling. And when we hear leg swelling, first we think about venous insufficiency. So most common diagnosis when person has leg swelling is venous insufficiency, and most common manifestation of venous insufficiency is varicose veins which are visible. It affects around 20% of world population after the age of 65, and most common cause of venous insufficiency is veins valve dysfunction. Normally these veins should pass blood only one direction, but if we have insufficiency, blood can move back also, and it can cause swelling and edema. It is called venous insufficiency. And most common causes are obesity, prolonged sitting, prolonged standing, and sedentary lifestyle is important. Also pregnancy is common cause, and treatment is weight loss, regular exercise, compression therapy, compression stockings, elevation of legs on the level of heart or more for several times per day. So venous insufficiency usually is benign condition, and it has no serious complications usually, but some cases there can be ulceration and other problems, but most commonly no serious complications. And venous insufficiency causes bilateral leg swelling, so both legs are affected. Another common cause of bilateral leg swelling when both legs are affected is heart failure. Heart failure affects people around 10% of population after 70. So if person is old and he or she has heart problems, there's high probability that this leg swelling is due to heart failure. But if person is younger and generally healthy, then it's less likely, and more commonly it happens due to venous insufficiency. Also, chronic kidney disease is important diagnosis because it also causes leg swelling, and chronic kidney disease affects around 10% of world population. It also causes bilateral leg swelling and not only one leg. And at this case we also have proteinuria, which means proteins in the urine, elevate creatinine level in the blood, foamy and bubbly urine, and muscle cramps because of loss of electrolytes. So if person has kidney problems, usually such person has also proteinuria or proteins in the urine and elevated creatinine level. This is very informative test, and a person can detect if he or she has such problems, and if leg swelling is because of kidney problems. Medications also causes leg swelling. Such medications are calcium channel blockers, steroids, and non-steroidal anti-inflammatory drugs. So leg swelling is very common problem if person intakes medications regularly. And obesity is very important factor for leg swelling, especially it increases risk of venous insufficiency. That's why obesity is important risk factors. Now let's talk about when we have leg swelling only one leg, or unilateral leg swelling. First, what we think when we see unilateral leg swelling is trauma. When person bump his foot into something, there is direct damage of tissues, and there is swelling, there is edema and pain and redness and swelling and person can remind that he got trauma, so it's easy to diagnose. Treatment is RICE, which means rest, ice, compression, and elevation. And in difficult cases and severe cases, surgery also may need it. So its most common cause of unilateral leg swelling is trauma. And second most common cause is cellulitis. Cellulitis is bacterial infection. You can see this image, and skin is red. It means that bacterial directly damages tissue here and cells, and we have redness, we have swelling, we have tenderness, painful leg, and treatment is antibiotics. And erythema also. This redness is erythema on the skin, and skin is warm when you touch. It's cellulitis when bacteria enters from, for example, from somewhere where is broken skin. Bacteria can infect and multiply here and cause cellulitis. It's common problem. Third important problem, it's not very common but important, is lymphedema. Lymphedema is especially important in people who undergo cancer treatment, because in many cases the removal of lymph nodes and lymphatic tissue, and it can cause lymphostasis and development of lymphedema. It means that lymphatic drainage is disrupted, and there is, because of this no lymphatic return, we have edema and we have swelling. And here is important point, and we should mention it. It is called non-pitting edema. Non-pitting edema. Now what it means? When we have lymphedema, we have non-pitting edema. It means that if you push, if you compress this swelling area and you remove your finger, there will not be indentation, there will not be pit, because in case of lymphedema, we have fibrous tissue here, we have thickened skin and no indentation. That's why it is called lymphedema. But if you push the person's leg with heart failure or deep vein thrombosis or many other conditions, you get and you compress and then release your finger, you see indentation. It is called pitting edema, and lymphedema is non-pitting edema. It's very important characteristic, and you can easily distinguish if this edema nature is because of lymphatic tissue problems, or it's because of, for example, heart failure, or it's because of kidney problems or deep vein thrombosis. And let's say about deep vein thrombosis, which is usually unilateral also. It causes when there is thromb formation, blood clot formation in the deep vein somewhere here, for example, and it causes disruption of venous return, and we have edema here, we have redness of skin, we have pain, we have swelling, and it affects usually one leg. In 90% of cases, it affects one leg. And the cause of deep vein thrombosis is prolonged immobilization, for example, long flights, bed rest, or surgery, and recovery period of from surgery. It can cause deep vein thrombosis, and it's important because it can cause pulmonary embolism, because this clot can move from leg to lungs, and it can cause pulmonary embolism, which can be life-threatening in many situations. And also sometimes we have unexplained one leg swelling, and in many cases it's compensated chronic venous insufficiency. At this case, maybe Doppler is clear, everything is clear, we have no important venous problems, no visible venous problems, but still there is swelling. It can be compensated chronic venous insufficiency. That's all I wanted to say. To summarize, leg swelling, usually if it's bilateral, if it affects both legs, it's usually because of venous insufficiency. If person is older, very old, for example 70 and older, it can be heart failure. It can be also chronic kidney disease if this person has kidney problems, and obesity is very important. Also, if person has hypertension and, for example, intakes calcium channel blockers, it can be also caused by these medications. And about unilateral leg swelling, first it's thromba, second it can be cellulitis, third is lymphedema, and lymphedema is important because it's non-pitting edema, and when you press your finger it will not it will not have indentation. It's non-pitting. And deep vein thrombosis also important when we have redness of skin and we have pain, redness, it's deep vein thrombosis and compensated venous insufficiency. Thank you for your interest, thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.